my name is Dr. Saif Gallagher. I am a double board certified plastic and reconstructive surgeon with a special interest in genital surgery, and in this video we are going to talk about a growing procedure I'm seeing in my practice here in Miami, Florida, and that is testicle enhancement. When it comes to testicular enhancement, how do patients choose which size of implant we put in? And this is a very important point. So first of all, if we're replacing a previous testicle, we can just choose whatever. Typically the off-the-shelf sizes come 1 through 5 and are usually in and around what we find in nature. They range from quite small to 5 centimeters by 4 centimeters, which would definitely be on the larger side. Now, if we are doing enhancement, and what I mean by that is we're leaving the natural testicle behind in there because it's still functioning, it's still producing sperm, it's still producing its hormones, and we just want to enhance the appearance of things down there with an implant, we need something that's going to adequately hide the original testicle. So in general, we want something that's about double the size of the testicle that's there. So depending on how big that is in the first place, usually we have to go a little bit larger than what's available on the shelf. And that's where our custom testicles come in. The largest I think I put in is about 7.5 centimeters. So it's a lot bigger than what you'd typically find in nature. How big we can go really depends on the patient's anatomy down there. But with testicular enhancement, it's important to know that there is a lower limitation on the size we can go to, because if we get too small, then when you look at the scrotum, you're going to see 4 testicles. Instead, what we want is the new testicles to be large enough to disguise the ones that are already there. So how exactly do we do testicular enhancement? What is involved? So I liken it a lot to a breast augmentation, meaning that we leave your own anatomy in there, it's functioning, producing sperm, testosterone, and we just use the implants to enhance the appearance of the area. And so what we do is we're going to displace our native testicles towards the back and a little bit superior, and then our testicles, as long as we have our new implants a large enough size, they're going to obscure them so it doesn't look like you have a 4-pack down there. However, it's very important to be able to access these testicles, as lumps and bumps and cancers can happen. So for the health of any man, we need to be able to examine those testicles. So in certain positions, you can manipulate and get a 4-pack so you can check those testicles, but in the natural resting state, it's going to look like a 2-pack. There are different ways described of doing that. It's been described as wrapping a sleeve around the testicle. I don't like doing that for safety reasons, as we have to be able to examine the natural testicles. Other people talk about anchoring the testicle in place. I find that tends to cause more problems. We don't do that in plastics. We do a lot of implants, and for example, going back to the analogy of the breast implant, we would never anchor those, as that can lead to difficulties and distortions of the anatomy. And then finally, the choice of implant is super important. There's basically on the market 2 types. There's this saline type, which I never use in my practice. They tend not to be tolerated very well. I prefer a much softer silk carving block. It can rupture or burst like breast implants can, as it's solid, but it tends to be really well tolerated and have a very natural feel. A common question I get is why testicular enhancement? What sort of patients get this procedure? And it really depends. I see a range of different patients in my office. In some cases, they've lost one or maybe both testicles because of cancer or trauma, something like that. Other patients have seen shrinkage just with age alone. We do see that. Or with certain medications, the most common one would be testosterone. But much more commonly than that, I see patients who are just not satisfied with the current size of things down there, and they just want to look better and feel better in their bodies. And it's really a lot like breast augmentation or breast enhancement procedures. I find patients are very similar to those patients. It's just something that's always bugged them regardless of their age. A lot of them tell me, you know, my wife thinks I'm crazy, but they come get the procedure. It's a safe procedure, and then they just feel better and get on with their lives. So what exactly to expect when you're getting a testicle enhancement procedure? So before we do the procedure, myself and the patient will have usually a few discussions about what the right size is for them. And then subsequently we'll decide, are we going to do an off-the-shelf implant or do we need a custom implant? In the case of custom implants, we have to get them manufactured, especially for the patient, obviously. So it takes a few more weeks to do that. So we need a little bit of extra time on the front end. But let's say fast forward to the day of surgery, myself and the patient kind of finalize all the details, chat a little bit in person. You get to meet with your anesthesiologist, and usually your anesthesiologist will decide with you what is exactly the best type of sedation to do. We always do these surgeries in the operating room because sterility is super important, but the surgery is not very invasive, so you're able to just do sedation or deeper sedation, general anesthetic, if that suits you better. And usually I leave that up to yourself and your anesthesiologist to decide which is going to be right for you. The procedure always takes me under an hour. You go off to sleep. We make as small as incision as possible, usually just about an inch, depending on the implants we're going to use. We put it low down in the center of the scrotum, and there's actually a natural line there. It's called the median raphe. So we use that, and with time, most of those incisions will pretty much disappear. We make the incision. Sterility is super important. I'm the only one who ever touches your implant. We make our little home for the implant, make sure everything is well controlled, and then with only me touching the implant, we open it, we pop it in, close things off, and move over to the other side. We like to keep the septum between the two testicles intact so the implants don't touch. We close up with dissolvable stitches, put a little pad down there because sometimes you can get a little bit of spotting in the first 24-48 hours. Typically, most of my patients take 1 to 2 weeks off work, depending, of course, how strenuous their job is. There's certain other restrictions with activity for example, riding a bike, that's usually going to be 4 to 6 weeks, or anything that puts direct pressure on the area. Things patients need to know is initially everything is going to be high and tight. Depending on how big the implants are, depending on the patient's anatomy, it's going to take some time for those implants to fall into the natural position that the testicles would be in. A common question I get is how painful is testicular enhancement? And the good news is it's really not that bad. As procedures go, it takes me under an hour. We usually do it through a little incision about an inch long, depending on the size of the implants, but we can often, as our implants are soft, squeeze a large implant through that 1 inch incision. So you're just healing that little guy, and otherwise it tends not to be very, very painful. Folks find things a little tight, maybe a little bit of pressure down there, but usually the majority of our patients get away with just Tylenol and or ibuprofen. We make something stronger available just in case, but in general, it's not a very painful procedure.